of weird, actually. Everybody's wearing masks, so yeah, I'm not used to this.
I'm not looking forward to maybe when it starts to get the end of the year, because I have a feeling that they're going to do the whole lockdown thing again.
I'm just excited to go.
Kind of excited. None of us feel safe about going back to school. Not one person that I've talked to feels safe.
I'd feel safer at my work than I would here.
I feel like they have good precautions. At least I'll be able to see my friends again.
The voices of students from across the country as they head back to school this week or get ready to go back. All sorts of emotions there and feelings. Kind of weird, excited, some feelings of concern about safety as well. Back to school is already an emotional time, and this COVID year could mean so much more for kids to process. So, as we like to do on this program, we give all 4 hours over to you to ask questions, and we bring in an expert to answer those questions for you. Dr. Jillian Roberts is back with us. She is our hero of the morning because she's in Victoria, where it is just 3:30. But she is here to help us deal with this very significant issue. Dr. Roberts is a child psychologist. She's the clinical founder of Amira Health and an associate professor in the Department of Educational Psychology at UVic. Importantly, she's our guest this morning. Welcome back to our show, Dr. Roberts.
My pleasure. I'm happy to be here.
Well, we're really looking forward to it and already have some excellent questions. I'm curious, first of all, though, how much of an issue is going to school, back to school for parents? What are you hearing and how much are you hearing about this in your practice right now?
For over the last couple of weeks, I've been dealing with people trying to make up their mind, that they've been on the fence and they've been struggling, weighing, the worry, financial worry if someone stays home to watch the child because they're so afraid of sending the child to school, through to families that have elderly grandparents living in the home and worried about the child bringing something home and worried about how the child would feel if they did bring something home and that affected the grandparent. So yeah, a lot of really, challenging questions. And many of the questions are very situation specific. It's like the families all have different kinds of unique needs and considerations that they have to balance out to make the best decision for their family.
I'm expecting that's what we'll get today. Very precise questions about specific family circumstances, and that's exactly what we hope to bring to you over the course of the 4 hours. But what I think a good place to begin would be with some of your tips, because good general rules for people contemplating all of this. Your first tip as we bring this up is really to the parents. Don't pass along your stress and anxiety to your children. What do you mean by that, and how do you do that?
Well, I've heard a lot of parents complain about that they don't believe the school is going to be ready. And I've heard parents do this, like they'll walk in the door and the child will be holding their hand and I say, "Oh, hello." And they said, "Oh, I needed to talk to you because I don't think that school is going to be ready." And a little part of me has a tug in my heart because I know this little one. I know this little one sees me maybe because they have anxiety. And here they are, looking to their parent for reassurance, and they're not getting reassurance. So I imagine what that first day of school is going to be like when that child goes back into that environment, knowing that their parents don't have confidence. So I would say that, if you have worries like that, please don't share those worries in front of your child.
Keep them to yourself, talk among, mommy or parent groups, to your partner perhaps, but try to maintain some sort of positivity if you can with the child. They really do pick up on whatever you're feeling, don't they? I like this in terms of discussion, though. One thing that you do want to talk about with your child, this is another of your tips, is discuss social distancing and proper hygiene. So I guess they need to be aware. Is this what you're suggesting, Dr. Roberts? They need to be aware of what they're going to be facing in this new classroom.
Yes, I would go over again with your child how to wash their hands properly and dry them properly. I would talk to them about hand sanitizer, maybe put a little sanitizer in their lunch kit or in their pocket. And I would also give them some words that they could use. For example, if a child is saying, "Oh, can I trade this for that in your lunch kit?" Or, like going to give them a hug or a high five, for them to be able to say something like, "You know what, I would love to share, but I'm not allowed to during COVID. I promised my mom." Or to say, "You know what, I'd love to give you a hug, but how about we do an elbow tap? Because of COVID, that just makes my family feel more safe."
So the scenarios, just so they have things to fall back on, and as you say, words to do so. So when you come up with words, obviously the conversations you're going to be having is dependent on the child's age.
Yes, absolutely. With the older children, where I've been focusing on is the concept of a bubble. Who is in your bubble? Who do you spend time with? Who would you like to spend time with? And be very cautious about the people in your bubble not randomly bringing other people into that bubble. So, and so my own children, we talk a lot about, who they want to socialize with, and are they in the bubble? If we've gone to a different level of openness, I let them add a couple of more children to that bubble. But in BC, where I'm located, we've had a spike in new cases. So we're back to a very tight bubble right now.
Let's jump into one from Heather K., Dr. Roberts. This is based on a high school experience. So high school students, many of them are going to be doing remote learning this fall. As parents, how can we help our teens stay focused on school learning and not video games and other online distractions?
Well, I think a really good idea is to incentivize them. What I've done in my family with my teen is get all of your work done, and then I'm okay with how you spend the rest of your day. But you can't go and explore the rest of your day until those basic, essential jobs, tasks, assignments are done. So I think that's important. The other thing I think is very important for teens is to take a look at the assignment, break it up into pieces, and assign like a mini assignment within that assignment every day. So it's not overwhelming. And they know that if they do this, then they can enjoy their life and enjoy their free time. But then the next day they do the next piece of it, and so on. What I find sometimes with teens is that they don't quite have the executive functions yet where they can do that themselves, like understand that this project is going to have all these components and I need to schedule those components into my schedule. I think helping and sitting down and sort of teaching that project management to your child and incentivize free time after the work gets done might be the best way of going about that.
Okay, fantastic advice. And Heather K., thank you for the question. This is from Michelle. It refers back to something we were talking earlier in the morning, Dr. Roberts, about one of your main tips in all of this, but it certainly bears repeating. Michelle is wondering, we all know that children pick up on adults' fears and anxieties. How is this affecting children? And then I might jump off from that. I mean, you can please answer this part of the question, but then what do you do to make sure that as a parent, your fears and anxieties do not affect your children?
Well, it's a very difficult thing. So first of all, it is incredibly hard on children to look at their parents and see them stressed and anxious and upset. Children look to parents to kind of get their information about how they should feel in a situation. If they look and see an upset parent, they may then understand that they should be upset and afraid as well. So parents really have to, back up and have the difficult conversations when they're processing their own emotions outside of the ears of children. Number one, that's incredibly important. So we call that bracketing, where you're kind of putting your own stuff aside so that you can be, a good counselor or a good parent. And I find just 3 little words help me to remember how to bracket. And that is, if I see myself kind of going somewhere where I don't want to go or sharing an emotion I don't want to share, the 3 B's. I be quiet, I back away and give myself some space, and I breathe, and then I try again. So be quiet, back away, breathe will help you kind of get that control that you might feel that you're losing. And it's so easy to lose that when we've been under so much prolonged stress.
No kidding. I love your simple, concrete strategies. They're very helpful this morning. Even if you do that as a parent and you are able to make sure that your child doesn't pick up on your own concerns, what if your child still is too scared to go back to school? What do you say or do for that child?
And I had a situation about that recently where I had a child with asthma, and she was going to be going back to school, but just she was so filled with fear that her asthma was going to be affected by COVID and that she wouldn't be able to breathe. And she had panic because she couldn't breathe in the past. And so I shared that situation and that conversation with that parent. And that parent had a choice, like they were on the fence. They could send to school or not send to school. After we realized how deeply afraid that child was, we decided to homeschool. And so I think it's really important to make decisions family by family. And I don't think you should discuss the choice with the child, like it's an adult decision. But when you're talking to your child, if you see some very strong emotions one way or the other, and you are on the fence, I think it's worthwhile to have a conversation between the parents, if it is possible, to honor the child's wishes.
Dr. Roberts, thank you.